So, when we study about the cocaine, so cocaine is also useful in the glaucoma. Mainly, cocaine used clinically as a local anesthetic. So, for the local anesthesia, cocaine is very useful. Then, it is an alkaloid form of the erythroxylol coke and sensation as if there is a small foreign body or the worms were under the skin. So in the cocaine, the patient feel that subjectively that there is a sensation of a small foreign body or worm were under the skin. It is useful in the glaucoma when there is an increased intraocular tension or pressure. Then there is a decreased corneal sensitivity, eyes are staring and eyes are expressionless. So when the cocaine is proved in during the drug proving, the patient shows that eyes are staring, there is a decreased corneal sensibility, eyes are expressionless, and there is an increased attention. So when this remedy is useful in the cases of the glaucoma. Next one is a colchicum autumnal. So meadow saffron is a common name of the Colchicum autumnal. In that case, patient objectively shows that there is inflamed eyes. There is a lacrimation, which is aggravation by the open air, lead in a constant motion. Then subjectively, the patient feels that there is a violent tearing pain in the eyes, and characteristics of that there is the smell of the food is very repugnant, even to the nausea. And clinically, the colchicum autumnal is useful in the cases of glaucoma, in rheumatic gouty cases, particularly with the debility. In these cases, be aware of the large doses. So, in such cases, we cannot use the colchicum in the large doses in the debility. So, objectively, when there is an inflamed eye and lacrimation, which is aggravation by the open air and lead in a constant motion with the violent tearing pain in the eyes, and when there is a smell of the food is very repugnant, even to the nausea, then such a characteristic symptom when present in a patient, then we can think about the colchicum in the glaucoma cases. So next one is a Comocladia dentata. So Clomocladia dentata is a very rare remedy. Is useful in the cases of the glaucoma when there is a ciliary neuralgia with the eyes feeling large and protruding, especially in the night, and it is worse by near warm stove and feel as if pressed outward. There is a see only the glimmer of the light with the left eye. There is the glaucoma sense of fullness. Eyeball feel too large. Motion of the eyes aggravated. Better in open air. Scratching by the motion and is worse by touch, warmth, rest at night. So Comocladia dentata is useful when there is a ciliary neuralgia and eyes feel too large, protruded, especially mostly in the night, and worse when there is a near warm stove and feel as if pressed outward. So sees only the glimmer of the light with the left eye, and there is a glaucoma with sense of fullness. So this is the main condition where there is sensation of the fullness of the eyeball. So there is a sensation of fullness due to the intraocular pressure is raised, which leads to the glaucoma, which is the irreversible condition of the eye. So eyeball feel too large. There is a motion of the eyes are aggravated, which is better in the open air, scratching by the motion, and is worse by touch, warmth, rest, and light. Then next one is a crocus sativa. So crocus sativa's common name is a saffron. Objectively, the patient shows there is a mydriasis. So it is visible twitches in the lid, and there is the upper lid mostly, and must wink frequently. So when we see the crocus sativa, objectively The patient shows mydriasis with the visible twitches in the lid, in the upper lid, must wink frequently. And subjectively, the patient feels that there is excessive photophobia, inclined to press the lid tightly together from time to time, feeling in the eyes as after the violent weeping, feeling as though water was constantly coming into the eyes and not when in the open air. So feeling of that water constantly coming into the eyes. So there is a lacrimation. Lacrimation, that feeling of the eye with the violent weeping pain and which is not in open air. So feeling of better in open air as seen in the crocus. After the reading of high, even during the day, eyes pain with the sore burning and some dimness, so that he was very frequently obliged to wink, and there is a feeling as if biting smoke in the eyes. So, in the crocus sativa, we show that there is a eye pain with the sore and burning and with the some dimness. So very frequently oblique to the wing and feeling as if of biting smoke in the eyes. So vision of the crocus sativa is that the light seems dimmer than usual, as if obscured by veil, frequently has two wipe and wink, and the eyes as though a film of mucus were over them. There is a photophobia, sudden flashes like electric spark, meridian, then sensation as if something were alive in the abdomen. So this is also a characteristic feature of the crocus that he feels that there is something alive in the abdomen, that that he is either pregnant or there is a baby in the abdomen, that he feel internally that something alive in the abdomen. It is mostly the sensation, mostly the subjective feeling of the patient. And light is a deep. Dimness is present with the photophobia and sudden flashes like an electric spark. Clinically, crocus is useful in the asthenopia, ciliary neuralgia, glaucoma when there is a posterior sclerochoroiditis, and other diseases like pain in the eye to top of the head and pain in the left eye darting to the right with the sensation of cold wind and blowing across the eye with the constant winking with the eyes and suck with the tears. So, clinically, when it is useful in the glaucoma, with the glaucoma, there is a posterior sclera choroiditis, asthenopia, ciliary neuralgia. The other diseases pain is also present, that is, it is useful that when there is a pre-existing disease in the patient which lead to the secondary glaucoma, it is useful in such a condition. Next one is the gelsemium. So we will study that how the gelsemium the patient looks. That eyes are drooped, eyelids are drooped, eyes are half closed, apparently inability to move the lid. Then lid are closed on looking steadily at the anything. Then lateral nystagmus on using the eyes. There is a mydriasis and pupils are sluggish. Subjectively, the patient feels that eyes feel too large and protrude as though bursting out of the head. There is a pressing and protruding the pain. So, patient shows that the eyes feel. The patient feel that eyes are large, protrude as though bursting out of the head. So, this is the main feature which was seen in the cases of the glaucoma. That when there is an increased intraocular pressure, the patient feel that the eyes are feel enlarged, protrude, and bursting out of the head with the pressing and protruding pain. But the patient shows that lids are drooping. There is a drooping lid. The eyes are half closed and lids are closed on looking steadily. There is a lateral nystagmus on using the eyes. Mydriasis and pupils are sluggish. The sluggishness is present in the gelsemium. Vision. So in the vision we can see there is a photopsis, spark, flashes, black spot on stooping, the object dance every pulse. So as the pulses are beat, the object is dance. If he feels that object is the dance, he cannot see a stable object in front of him. And there is a photophobia. The spark flashes black spot on the stuping. The characteristic of the gelsemium is that there is a tendency to sudden violent irregularities of the circulation and rush of the blood to the head with the painless throbbing in the whole body or in the brain. So there is a painlessness, throbbing pain in the whole body or in the brain. This is a great remedy for sunstroke, for the heat, prostration, eyes trouble from exposure to the very bright light and the glaucoma. So also with the glaucoma it is useful in the supraorbital neuralgia. Then next one is a nux vomica. So when we study about the nux vomica in the homeopathic materia medica, objectively the patient shows that lids are twitch, eyes are blink, there is a movement on difficult on account of the muscular stiffness, then lacrimation in the morning while yawning and eyes are full of water. Subjectively, the patient shows that there is a photophobia. So, morning, a smarting, dry feeling in the inner canthal. In the morning in bed, there is a biting in the eyes with in the inner, in the external canthal as from salt with the lacrimation and the canthi are painful as if sore. There is the margins of the lid are the painful as if rough and sore on touch and morning and pressure in the upper lid and in the margin. The how the patient sees the nux vomica, that there is a cloudy vision. We feels that there is a cloud before the eye, so he can't see anything clearly. The glittering appearance before the eyes, and there is a floating back and grey point. The region are very sensitive. There is a retinal hyperesthesia and glaucoma. Characteristic of nux vomica is that there is a thin, irritable, choleric person with the dark hair, person who make a great mental exertion or lead a sedentary life and worse in the morning with the dull frontal hair. So these are the very characteristic features of the nux vomica. Then next one is opium. So opium is also useful remedy in the glaucoma when there is a half closed eyes, dilated eyes, pupil are insensible, pupil contracted, and there is a ptosis like a gelsemium and costum. When there is a staring eyes, glassy eyes, worse by the heat during and after sleep, and better by the cold thing and the constant walking. So when the opium is used in the glaucoma cases when there is a half closed eyes. Eyes are halfly closed. There is a dilation of the eye. Pupil are insensible, contracted, and there is a ptosis like a gelsemium and causticum. Opium also shows a ptosis. There is a staring eyes. The eyes are staring, glassy, and which is worse in the heat during and after sleep, and better by the cold thin and constant walking. So next remedy is osimum. Osimum is also a rare remedy which is useful in the cases of the glaucoma with the iridescent vision, then violent supra and infraorbital neuralgia, when there is a violent pain and lacrimation with the green color surround the candlelight with the conjunctivitis, increase in intraocular tension, dim sight, and photophobia. So, osimum is very rare remedy when glaucoma is seen with the iridescent vision. When there is a violent supraorbital and infraorbital neuralgia, there is a violent pain, lacrimation, as if bryonia, then there is a green color around the candlelight. So patient sees that vision in front of vision, there is a green color, and this green color is surrounded with the candlelight. That patient cannot see the vision clearly. He sees that there is only green color and which is surround the candlelight. And there is a conjunctivitis with the increased intraocular tension which lead to the glaucoma with the dim sight and the photophobia. So these are the main feature of the osimum symptom. The next some remedies of homeopathic therapeutic of glaucoma we will study in the tomorrow session. So for the today we can stop here. So have a good day. Bye bye.
Bye, ma'am.